Hi viewers, ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. This is Dr. Chandrasekhar, MD physician, diabetologist. So we are coming to the part 2 of the hypothyroidism. So as we saw in the part 1 about the importance of the thyroid and hypothyroid in the children, we are straight away go to very important thing, that is hypothyroidism in women's. So this includes pregnant and non-pregnant women. So first and foremost, pregnant normal women. If you see the incidence, this hypothyroidism we see 4 in 1000. Andre 4 ಹೆಂಗಸರಿಗೆ 1000 people. That is very common if you see that. And in men also we see it is 1 in 1000 population. So coming to the clinical features, we saw in the previous part 1, it is the same clinical feature we have. Only one thing I want to tell the viewers that so any women of reproductive age complaining of generalized tiredness, okay, then easy fatigability, please kindly do as I say in the part 1, that is the sugar and thyroid profile test. So coming to this pregnant women, which is very important, that is hypothyroidism in pregnancy. So when do you want to suspect thyroid? Usually in a reproductive age group of a women, what you want to do is, suppose patient has repeated miscarriages, patient is planning for pregnancy, they have any history of thyroid, ಅವರು ಒಂದು ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಏನಾದರೂ ಒಂದು ಥೈರಾಯ್ಡ್ ಡಿಸೀಸ್ ಇದೆ, ಅವರು ಎಲ್ಲರಿಗೂ ಸ್ಕ್ರೀನ್ ಮಾಡಬೇಕು. ಈಗ ಎಲ್ಲ ಪ್ರೆಗ್ನೆಂಟ್ ವಿಮೆನ್ಗೆ ಥೈರಾಯ್ಡ್ ಟೆಸ್ಟ್ ಕಂಪಲ್ಸರಿ ಸ್ಕ್ರೀನಿಂಗ್ ಆಗಿದೆ. ಸೊ ಆ ಒಂದು ಫರ್ಟಿಲಿಟಿ ಈ ಥೈರಾಯ್ಡ್ ಡಿಸೀಸ್ನ ಕಂಡುಹಿಡಿದು, ಇಫ್ ಯು ಟ್ರೀಟ್ ಥೈರಾಯ್ಡ್ ಪ್ರಾಬ್ಲಮ್, ದ ಫರ್ಟಿಲಿಟಿ ರೇಟ್ ಹ್ಯಾಸ್ ಇಂಪ್ರೂವ್ಡ್, ಮಿಸ್ಕ್ಯಾರೇಜಸ್ ಹ್ಯಾವ್ ರೆಡ್ಯೂಸ್ಡ್. ಸೊ ಈ ಪ್ರೆಗ್ನೆಂಟ್ ವಿಮೆನಲ್ಲಿ ಏನು ಮಾಡಬೇಕು, TSH ವ್ಯಾಲ್ಯೂ ಬಂದು ಲೆಸ್ ದೆನ್, ಯು ಹ್ಯಾವ್ ಟು ಕೀಪ್ ಲೆಸ್ ದೆನ್ 2.5. ದಟ್ ಈಸ್ ದ ಟಾರ್ಗೆಟ್ ಟು ಕೀಪ್ ಇನ್ ಪ್ರೆಗ್ನೆಂಟ್ ವಿಮೆನ್. Why is that? Because TSH has the same molecular basis like FSH, so you get high TSH, so you have to reduce the level of TSH compared to normal women. Then coming to this, how do you want to analyze whether it is a primary hypothyroidism or a central hypothyroidism? Primary TSH will be definitely above normal, that is more than 10 only we are going to treat thyroid hypothyroid. So if it is normal or low TSH and with low T4, you want to suspect central hypothyroidism. So you want to treat only with LT4, levothyroxine. That is the drug of choice for central hypothyroidism. Then coming to this one more entity called following radioactive therapy, that is you want to remove this with chemically, want to give radioactive iodine, patient will go for what is called hypothyroidism. Initially patient will have low TSH. So you remember, in this situation you will have low TSH in hypothyroidism. So then coming back to this dosage of levothyroxine, you want to give according to the body weight, that is 1.6 microgram per kg. That is patient weighing around 60 to 70, it comes approximately 80 to 90 micrograms per kg. Only in few conditions you are going to increase the dose or decrease the dose. Increase the dose, decrease the doses. Number one is cardiac patient. You are going to compulsory reduce because it has inotropic effect. So you want to reduce the dose nearly 25% of thyroid dose. You increase the dose of this levothyroxine LT4 in pregnant women around say 25 to 30% of normal body weight dose, because it requires as advanced pregnancy. So in patient with, sometimes you usually give this dose as a OD dose. In pregnant women you can take up to say 9 doses per week. That means more than 1 dose per day. So in athyroid, pregnant women with athyroid state, there is no thyroid gland, you want to increase the 40 to 45% of the required dose of the thyroid hormone. So this is the thing for a pregnant woman. If you go back to this, and when you want to treat one important entity called subclinical hypothyroidism, andre ಒಂದು ಟಿ ಎಸ್ ಎಚ್ ವ್ಯಾಲ್ಯೂ 5 to 10 ಇದ್ದರೆ ಯು ವಾಂಟ್ ಟು ಟ್ರೀಟ್ ಇನ್ ರಿಪೀಟೆಡ್ ಮಿಸ್ಕ್ಯಾರೇಜಸ್, ನಂಬರ್ ಒನ್. ನಂಬರ್ ಟು, ಪೇಷಂಟ್ ಹ್ಯಾವಿಂಗ್ ಸಿಂಪ್ಟಮ್ಸ್ ಆಫ್ hypothyroidism. Then you want to treat only with low dose, that is 25 to 50 micrograms per kg per day. That is when you want to call a subclinical. Suppose one patient TSH ಬಂದು ಫಸ್ಟ್ ಅರೌಂಡ್ 6 ಇದೆ, ಯು ಡೋಂಟ್ ಸ್ಟಾರ್ಟ್ ಎನಿ ಮೆಡಿಕೇಶನ್, ಯು ವಾಂಟ್ ಟು ರಿಪೀಟ್ ದ ಸೇಮ್ ಟೆಸ್ಟ್ ಆಫ್ಟರ್ 3 months. That should have sustained levels of TSH, because TSH is elevated in critical care setup, TSH is elevated in fever setup, patient who has any acute illness. So please kindly don't advise any thyroid function test in acute illness. That's the take home message. So so the and when you want to expect the relief of symptoms, once you start thyroid, you expect one after 3 months of normalizing the TSH. You ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳಿ, TSH ನಾರ್ಮಲ್ ಬಂದಮೇಲೆ 3 months ಆದಮೇಲೆ ಸಿಂಪ್ಟಮ್ಸ್ ಎಲ್ಲ ರಿಲೀಫ್ ಆಗುತ್ತೆ. ಹೌಎವರ್ 10 to 15% will have the persistence of the symptoms of hypothyroidism. So that's the topic for today. Hope you enjoyed this hypothyroid in women. So if you really like this video, please share, and if you really like this content, please subscribe. Thank you for watching. Namaskar.